Hi, this is Andrew Phillips, the founder and editor-in-chief of EM Coach, coming to you with another installment of the monthly question for EP Monthly. Go ahead and take a look if you haven't already at this question because it's a huge spoiler alert with what I'm about to say. Pause for a second, take a look at it. All right, so this particular question, it's one of those where the diagnosis is kind of sly in the sense that it doesn't scream out in front of you. A patient presents with knee pain, had heard a loud pop, was unable to bear weight at the time, and now you shoot an x-ray and it looks fine. The x-ray doesn't show any acute fractures, everything's in the right place. The question is, what do you do next? And this is where you have to really listen carefully to the history and dig a little deeper, because she actually presented with a knee location, and often by the time they get to the ED, this location will have self-reduced. And so then you're presented with an x-ray that looks normal, and you got to get enough of that history to realize that there may have been a full knee dislocation, and then you've got to look out for the artery. So a negative x-ray when patients present with sudden knee pain and inability to bear weight does not mean that there was not a dislocation prior to shooting that film. Keep this diagnosis in the back of your mind whenever you see that knee pain with a sudden acute presentation and severe pain, inability to walk. Really get a sense of whether there was deformity at the time, or if this is a patient you just think maybe didn't notice a deformity. It's easy to do, free to do, an ankle brachial index, and can really save a lot of heartache in the end by missing something as serious as a popliteal artery injury. This is Andrew Phillips from EM Coach, wishing you a good month.